Angelica says gang members raped her twice and extorted her small tortilla business until she couldn't pay. Then they said they'd take her 5-year-old daughter Ashley instead.
They sell the children to people for sexual abuse. That was when I decided to leave my country.
Since 2011, Central American women have been coming to the United States in greater numbers than ever before. They're fleeing homelands defined by extreme violence and poverty, and seeking a safe, healthy, hopeful place to raise their families. But did you know that the longer they stay here in the US, the worse their health is likely to become? My name is Pietra. I'm a doctoral candidate in public health, and I'm working with a really inspiring group of community partners to try to understand why immigrants' health gets worse over time and what we might be able to do to prevent it. Together, we're designing a study with Latina immigrant women workers, looking at how migration, social conditions, and social networks interact to impact health. I'm asking you to help us fund this important and timely work. When we're done, the results will be used by governments and nonprofits and others to advocate and to inform programs. Migration is traumatic. It can be a long, dangerous, physically difficult journey for many. And if they survive that, imagine starting over in a whole new place where you might not speak the language. You have to make all new friends and find new organizations and people that you can count on. You have to try to figure out how to find a job and a place to live, where to buy familiar foods, how to navigate the healthcare system, and how to just get your child through school every day. In public health, we know that challenges in any one of these domains, trauma, housing, healthcare, work, or food, can negatively impact health. When women migrate, they're challenged in all of these domains at the same time. The goal for our research is to figure out which aspects of women's lives help them be healthy and where we might need more outreach or different services to avoid that slip in health that we traditionally see with immigrants over the long term. The end goal for this study is to help women stay healthy so that they can lead productive and fulfilling lives. We've been working with community partners since the beginning of this project, partners like the Brightwood Clinic in Springfield, Mother Woman in Holyoke, and the ACLU Immigrant Protection Project. So we know that they'll be able to use the local data that we collect to inform their programs for the direct benefit of immigrant women. But we can't do any of this without your help. We need to raise funds to compensate women for the time they'll be giving to our study, and also to hire a research assistant so that we can reach as many women as possible. There's more information about this research project and how the funds will be used on our GoFundMe page. Please take a look at that page and share it with as many people as you can, and please donate today. Any amount, no matter how small, will make a big difference for getting this project off the ground, and we really appreciate it. Thank you so much for your support.